after the wave of COVID-19 wrecked lives across the world 4 years ago. The world had become more alert about the emergence of pathogens. With the appearance of infectious diseases, public health authorities immediately activate protocols and interventions that are meant to stem the tide of any spread. Only recently, a cholera scare swept across Nigeria, and health officials have been grappling with the threats as President Bola Tinubu established a cabinet committee to oversee emergency responses. And now, in the last couple of weeks, we've seen a concerning resurgence of the Mpox virus. This time, new variants emerging, causing health organizations to raise alarm. As of August 14, 2024, the World Health Organization declared Mpox a public health emergency in Africa, with over 14,250 cases and 456 deaths reported this year. The Nigerian Center for Disease Control and Prevention on Thursday, August 15th, said Nigeria had recorded a total of 39 confirmed cases of Mpox, but 0 deaths across 33 states and the Federal Capital Territory. Welcome to this episode of our Explainer as we examine these health matters among other public health related questions we face as a nation. Adding another layer to our discussion, we will also touch on the recent policy introduced by President Tinubu aimed at curbing the exodus of healthcare professionals, commonly referred to as JAPA. This policy seeks to retain our skilled doctors and ensure that our healthcare system remains robust in the face of these challenges. Here in the studio with me is Dr. Chimere May Ohajinwa, a public health expert and environmental toxicologist. She's the team lead of Sea Circle Research and Sea Circle Foundation for Sustainable Health and Environment. It's good to have you in this discussion, Ma.
Thank you.
You're welcome. So let's dive right into the conversation, right? So can you start by giving us an overview of the current situation of the cholera outbreak in Nigeria right now? Is the threat still out there? And what has the government done so far to curtail the spread?
Oh yes, okay, yeah. On the overview, the spread is still out there. We have cholera outbreak. Yes, it's coming down because there's been a lot of effort put in place. There's a lot of public awareness being created in the communities, in the hospitals, talking to people about it, because this is something that is endemic in Nigeria. So it's always coming up every rainy season, because this is a season where you have flooding, and then some people that don't have good sockaway system, the open defecation, so water, the flood carries it into the river or contaminates our water sources, and you get it. So cholera is like an environmental health disease that is being promoted by very poor hygiene, right? So yes, it's still there, but there's a lot of awareness because of how it came, especially in Lagos. So it has gone down. But if you look at the NCDC website, we have over 5,000 cases and about 170 people already dead because of this. So it's a disease that you don't take lightly. It's a disease that can kill in hours. It doesn't even stay that long, because people are losing water, you're vomiting and stooling at the same time, running fever. So because they are losing water, so people get weak, run fever, then some people die if nothing is done immediately. So yes, that's the situation right now. And another thing is, remember that the NCDC report is the number of places that is reported in NCDC. So it's possible that some people already died in the rural areas that was not captured, and you just give it another name. You don't know what happened. You vomited and, that kind of a thing, which are wizard. Meanwhile, it stays. So remember that this number that is being reported is even conservative. Yes, that's how serious it is.
Okay. So the president had established a committee to respond to emergency cases. So are you aware of how effective this committee is and all of that, and how effective they've also been in responding to cases? Do you have?
Okay, just like when we had Ebola or COVID-19, I think Nigerian public health system is quite efficient in trying to respond to that, because if you look at how we responded to Ebola, look at how it happened in other countries. It didn't happen like that in Nigeria. There was very swift action to quarantine whoever was affected and thereby stopping it from spreading very fast. So I don't have any doubts in the capacity of the committee to take care of it, because it's something that we've been able to do over the years to see how we curtail disease that will have spread so fast in other places. But when it comes to Nigeria, the public health system is quite strong that it has a way of curtailing them faster in other places.
Mpox, for the benefit of those that don't know what it is or how it's being transmitted or early signs and symptoms of the Mpox disease, I want you to just throw some light into it briefly.
Okay, so Mpox is monkeypox that is being transmitted from person to person or from animal to person via the virus known as monkeypox virus. There's also a vaccine to stop that, just like there's also a vaccine for cholera. So the monkeypox, known as Mpox, looks like smallpox, but it's not smallpox. Smallpox is more severe than monkeypox, and so it starts with look like a rash, then it starts growing, looking bigger, and then there is fluid in it. So when there is skin to skin contact, or you face the person so closely, you're sleeping in the same bed with the person and you people exchanging your breath so closely, the person can transmit it to you. Because if that fluid touches another person, they can transmit. So it's quite infectious. It can also be transmitted through sex, right? So because you are having skin to skin, and so it can be transmitted through sex. So usually they run fever within 3 days. We expect that after you've contacted it, within 3 days you start seeing those symptoms. You're running fever, you're having those rashes that starts to grow, and then when it bursts, it releases water. These are some of the signs that you already have it. So if you have those kind of things that you don't understand, it's better you get to the hospital and get it treated. It can also kill if you don't treat it. So if you are seeing things like that, because I was discussing with somebody today about monkeypox, and I said, "Oh, do you know about monkeypox?" "Oh, somebody in their village already have this," and nobody knew what it takes. But it's in the village, and the person already died. I said, "Wow, somebody already died?" I said, "Yes, but it's not of you to treat. You're running away, so it's only left with the person's family to take care of the person, and they don't know how to take care of the person, and the person keeps spreading it. The disease keeps spreading and spreading and spreading, and yet nobody knows what it is, because it's not something that is common. It's a rare disease."
So in your experience, right, what are key strategies that you feel can be employed to curtail these viruses?
Okay, so one of them is what NCDC is doing. So there should be a lot of surveillance. So meaning that somebody's already taking notes. That surveillance, whether it's in rural area, in township, in the slum, wherever it's being captured, recorded. So that data, you already know where they are. And then with that, you can deploy interventions to curtail it, whether you're going to quarantine them, whatever method you want to use to make sure that it doesn't spread. Another one is the risk communication, communicating, letting people know there's something like this. We're talking about it, there's campaign, it's on TV every day, jingles, radio, social media, like education like this, making people know that, oh, there's something now on ground, be careful. Then also we can have the vaccination is also available. So if you also talk to people about how to prevent it. You are constantly washing your hands because you don't know who you have touched, whether that person has it. And then another thing with the monkeypox is that it can stay for a longer period. Like if the fluid from the infected person is here, for example, it can be alive for some hours, and so if you are touching things and you're not sure what you're touching before that's actually why it's important you wash your hand regularly, because you don't know where you've touched your things, especially in public places, people entering lifts, climbing staircase, touching the rail of the staircases. So whenever you know you've touched staircase, those kind of public places, quickly wash your hand, because you don't know who touched it and what fluid has dried up there when you pick it up. So that's why you see people before they eat, you go out, come out, before they eat, you wash your hand. So you're not picking up things you're not sure of. So those kind of small things, the making sure your water is clean, the sanitation is clean, you are having permission to put sock away where you're supposed to put sock away. Because sometimes people think, oh, when environmental health officer says, oh, you have to get permission for you to dig your sock away, you think they're disturbing you. No, they're not disturbing you, because you can be drinking another person's sock away without knowing, because everybody build their house and put fence. You don't know where my sock away is, you don't know where my borehole is. I don't know where yours is, you don't know where mine is. So I can dig my own very close to your own and be drinking and think I'm drinking clean water, not knowing I'm drinking water that is contaminated. So you see, some of these policies are actually good, but the communication of it is also important. So the sanitation comes in. Then also when people are sick, how you're communicating in the villages, you are involving the stakeholders in the village, educating them about it so that you can promote it. You can promote the information that, oh, there is something like this in town, be careful. Even in schools, so that you will know that you have to be careful about it. Like training people that are supposed to be trained, doctors, nurses, health workers, especially in rural areas, that capacity building, they know about it. So you see, these are some of the things, strategies, the public health strategies they put in place to curtail any public health problem.
So looking beyond immediate responses, what long-term solutions do you think are necessary for Nigeria to strengthen its healthcare system?
Oh, okay. So now we're having issues of our doctors or healthcare workers leaving the country, Java. So we can look at how we can better their welfare, increase the salary, the work environment, the right equipment and tools, the capacity training, the even returning people in the rural areas. Because sometimes these things start in the rural area and keep spreading and people don't know. So, but if the rural areas are not comfortable, nobody wants to stay there. But the truth is that disease can come from rural area and come to the city and also affect you in the city, right? So considering having a holistic approach to it, so it's not just, oh, you increase the salary, but there is no drug, there is no light, there is no water, or you don't give them accommodation, or you know, that kind of, you make things so difficult for them. You're not employing enough people. They're always, every time maybe there is a ban on employment, so there are very few people working, and they are so stressed out that they're not giving their best anymore, you know. So every time you go to federal hospitals, teaching hospitals, it's so choked, so many people, patients, very few hands are tending to them.
I guess that's why the government wants to begin to retain healthcare. I guess that's the reason for the new policy, right? Yeah. To retain our healthcare
workers.
Them
to stay back.
Encourage them to stay back, and but to even encourage those in diaspora to come back, right? But I believe there should be more that the government needs to do to encourage them. Like you've already listed, infrastructure and all of that, the working conditions for the health workers.
They need allowances, give them allowances, anything that can encourage them to stay longer, to, you know, a good working environment that will make the person stay. Not that everything, the protective way is not there, when it's there is not enough. You know, so you're not even sure whether the patient. So there are instances where you have this kind of public health problems and the doctor or the nurse is dead. Like the Ebola case, the doctor that treated the person is dead. And not only the person, some nurses died. The same thing with COVID-19, there are doctors and nurses that died. Lassa fever, the same thing. There are doctors and nurses that died. They didn't get it from their home. They got it from patients that came to hospital for treatment. So what are we doing to make sure that we protect them as well? So there must be enough protective ways. You know, the environment must be conducive. You're not overworking yourself, because by the time you're overworking yourself, you now start putting yourself at risk. And remember, if they get infected, the whole thing is not just ending in the hospital. They are going home to their families to transfer it to their families as well.
Thank you very much, Ma. As we come to the end of today's enlightening conversation, I want to say a very big thank you to you, Dr. Ohajimwa, for sharing invaluable insights with us on this edition of our Public Health Explainer. Right. So as we move forward, it is very important that we remain vigilant and proactive in protecting our health and the health of our communities. To our audience, I want to say thank you for joining us today. We encourage you to stay informed and engaged on this topic and to share what you've learned with others. Remember, our health is intertwined with our environment, and together we can make a difference. Until next time, stay safe and take care.